and going forward right now? And how do you, Stephen, feel that this will impact on patients? What's the outcome this is going to have on patients if they don't invest in primary care? So a question to the two of you, really.
Well, general practice is in crisis. We've been saying that for the last 4 years as part of the FENPI submissions. I emigrated in 1990 to come back from the NHS to the UK and brought some of my experiences there, having set up Bright Doc with another group of GPs in 1996. 10 years later, we were able to set up D-Doc in North Dublin. Unfortunately, we were 10 years behind the curve. The idea was there 10 years ago, but we couldn't get the funding for it. But we're at a precipice which we've never been here before, whereby it's not only young doctors who are leaving, it's also experienced GPs. There are many middle-aged GPs in their 50s who are heading abroad. That's never been seen before. The world is a smaller place. You've got Skype, you've got travel very easily, and parents will travel these people. And the problem is that we're fed up apologising for the healthcare system. It is not a pleasant place to work. It's quite interesting, the media narrative at the moment, that we've got an obsession with GSOC. We have no obsession with a hospital in Letterkenny that has 50% of the junior doctors only working up there. So 50% of the posts in that hospital are vacant. You've got consultants up there who have no junior doctors doing ward rounds and running outpatients with them. We've only had one article in the media in regard to that. I was at an ambulance a session whereby somebody was knocked down outside my house, 1 kilometre from the Mater Hospital. An ambulance turned up with no trolley. These stories are all over this country, and the media are not reporting it for some reason. We have a healthcare which is in crisis. We have patients receiving letters on a Friday whereby they say if you don't cancel your appointment, if you don't confirm you're on a waiting list, you will have your appointment cancelled. I have one patient that he was received on a Friday, he was meant to let them know by a Monday, that was a bank holiday Monday, or otherwise his appointment is gone. You have individuals like Professor O'Shea in the Business Post last Sunday indicating this, agreeing with this. Unfortunately, we have now got virtual waiting lists, and that's how the management of the waiting lists are done. So what's happening with general practitioners, we're having to re-refer patients that we've already referred. So what has happened is the junior doctors are not going into GP training and other training posts, they're actually leaving at their internship level. We've had a discussion with the HSE in regard to some of this. So what they're looking at is indenturing doctors in regard to GP training posts. And what we've said to them is, if you do that, they'll leave before they even get there. The problem is